the scanxiety, so you got the scans on Friday and then you're waiting the weekend until Monday comes along, and yeah, that was pretty nerve-wracking.
This is the scan that we had with the tumor there prior to the surgery.
Nick Saleum's doctor's appointment in Eau Claire is anything but routine for most 29-year-olds. Today, he's seen scan results following his second cancer surgery in 3 years.
We don't see any clear evidence of any recurrence of the tumor or spread of the tumor.
In 2016, at age 26, Nick was busy working, spending time with his girlfriend, and discovering a newfound passion for photography and videography, when one day he felt a painless lump in his left forearm. One doctor misdiagnosed the lump as a gangling cyst or lipoma, but Nick noticed the lump growing and went to see another doctor. A biopsy revealed a rare cancerous tumor, epithelioid sarcoma. He was already stage 3.
Sarcomas are rare, so more likely than not, you don't have a sarcoma if you have a lump. However, there are certain signs that we always recommend. If you have an enlarging lump that's deep, not superficial, but deep, and more than the size of a golf ball, that needs to be evaluated.
And the way it spreads is very unique, kind of like what Nick is. It starts in the soft tissue here, and starts spreading through the soft tissues, through the arm, and then into the armpit area, and then eventually elsewhere. Probably in the United States, there's only a couple hundred cases each year diagnosed.
Dr. Scott Okuno is the medical chair of oncology at Mayo Clinic Health System in Northwest Wisconsin and also practices at Mayo Clinic in Rochester, Minnesota. Dr. Okuno is also a world-renowned expert in sarcoma and just one member of Nick's coordinated care team, which includes oncologists, radiation oncologists, surgeons, and many more, according to nurse practitioner Kay Holt.
We have the cancer guide, the social worker who can help with those financial issues and emotional issues. We have the chaplain, we have nutritionists who can help with things. So we are very lucky to have all of those services right here in Eau Claire.
Following the initial diagnosis, Nick underwent 6 rounds of chemotherapy and 25 radiation treatments in Eau Claire. After that, orthopedic oncologist Dr. Peter Rose in Rochester performed surgery to remove the tumor. While grueling, Nick's arm was spared from amputation, and he was grateful to receive the majority of his treatments close to home.
Everything just didn't taste good. I felt like it just tasted like eating cardboard for the most part. And
how did water taste?
bad. Yeah.
During this time, Nick learned more about his sarcoma and shared his personal journey through video.
Hi, my name is Nick Saleum and welcome to my YouTube channel. I had cancer 2 years ago. I was diagnosed. It was called Epithelioid Sarcoma. Welcome to my story.
He's become an advocate, creating awareness, pushing for research funding, asking doctors lots of questions, and helping others through a Facebook group. He even donated his tumor for epithelioid sarcoma research.
And if I don't talk and other people don't talk, then we really don't get nowhere, so.
With therapy and regular monitoring, Nick's recovery was going well. But in November 2018, Nick felt a painful lump in his bicep. An MRI, then biopsy, confirmed a recurrence of the sarcoma.
Hello? Yeah, I'm calling with results of that biopsy. Is now a good time to talk to you?
Yeah.
Okay, so it does look like the cancer has spread to the upper arm at that spot that was biopsied last week.
In January 2019, Nick underwent a second surgery with Dr. Rose in Rochester, during which the tumor was removed and his limb again spared from amputation. He also underwent preoperative and interoperative radiation, a plan coordinated by radiation oncologist Dr. Sarah James in Eau Claire and her colleagues in Rochester.
Now, with his particular situation, historically, these tumors were treated with amputation up front. Limb sparing is what is standard now. Certainly in the setting of recurrence, doing this limb sparing could only be done because we have expertise here at Mayo to do that.
Nick knows recurrence with his type of sarcoma is high and that he may eventually lose his arm. But make no mistake, there's no quit in Nick. His cancer team says he never looks back, only forward. He's working hard to regain strength in his hand and hopes to one day get back behind the lens.
His passion for media and with sharing his patient experience is just quite good and quite refreshing to see. My wish for Nick is for him to have a long, happy life, cancer-free from now on.
The Mayo Clinic team, they've been great to me, and then I can't think of anyone else to take up all this because, I'm in the right hands. I guess I'm still here for the most part, and I got the upper hand at the moment. I guess going through all this made me a better person, stronger person, just